In case no one told you today, you are going to be a great nurse. Thank you for joining us today as we take a look at the person-centered care framework presented by McCain and McCormack. Through this presentation, we will introduce you to the ideal approach to practice as a nurse and break down the fundamental prerequisites of person-centered care. As a learning outcome, you will be able to explain person-centered care prerequisites and take away some examples on how to implement this valuable tool in your professional life. We will also look at some ways to overcome any challenges you may face in the real world.
Over the next 3 years, you're going to learn all the assumed knowledge to be a nurse: anatomy, pharmacology, wound care, and other varieties of aspects. What you do not want to miss out on learning is the essence of how to care. Caring is something that has gone hand in hand with nursing for many years. More recently, the World Health Organization and most healthcare professionals have acknowledged person-centered care as an essential component in the journey to improve the health of the world's population. To be a great nurse, you are going to want to join in on this journey with your future colleagues. But first, you need to really understand the framework, and in return, you will be able to provide your patient with the best care possible. So who are McCormack and McCants? Well, Brenda McCormack is a professor and the head of the Division of Nursing of the School of Health Sciences in Scotland. Tanya McCants is also a professor and is the director of the Institute of Nursing and Health Research in Northern Ireland. Together with over 15 years of valuable experience as practitioners, educators and researchers, they developed the framework for delivering person-centered care. But what is person-centered care? Person-centered care was defined by McCormack and McCants as an approach to practice established through the formation and fostering of helpful relationships between all care providers, service users, and others significant to them in their lives. It is underpinned by values of respect for persons, individual right to self-determination, mutual respect and understanding. It is enabled by cultures of empowerment that foster continuous approaches to practice development. Closer to home, the Australian College of Nursing also reflects on the framework. They believe that the principle of person-centered care is a central tenet underpinning the delivery of nursing care and healthcare generally. Person-centered care means treating each person as an individual, protecting a person's dignity, respecting a person's rights and preferences, and developing a therapeutic relationship between the care provider and care recipient, which is built on mutual trust and understanding. A nurse's ability to deliver person-centered care is determined by the attributes of the nurse, their nursing practice, and also the care environment. Here's what the students in our group had to say about why they wanted to become nurses and how person-centered care is going to influence their ongoing studies and future career. Adina said she wanted to be a nurse to help and care for people in times of need. Having the person-centered care skills is going to ensure she gives the best care she can. Eva said she wanted to be a registered nurse in remote areas of Australia to help give people the access to healthcare that gives a person-centered care approach. Louise said she's never met a nurse who isn't proud of their job. She's looking forward to being a part of a community that doesn't see work as a chore, but as something they love. If she loves what she does, she'll be able to commit 100% to it. Sabina said she wanted to become a great registered nurse by having these specific qualities and using them in the workplace. Taylor said she wanted to become a nurse to assist patients at the most vulnerable times and contribute to saving lives. Enabling person-centered care in her practice will provide patients with a sense of safety and involvement, which is essential to providing the best care possible. Tegan said she wanted to be able to treat her patients with dignity and respect. And lastly, Tia said that being a nurse means working as a part of a team to reach a similar goal. She looks forward to being a part of something wonderful with a group of like-minded people. The framework of person-centered care has taken over a decade to develop, and it became increasingly recognised as a tool that shone a light on practice and brought a shared understanding and a common language to person-centeredness in nursing. The building block for person-centeredness is respect for personhood. It is based on the models of being in relation, being in a social world, being in place, and being with self. It is also about listening, thinking together, coaching, sharing ideas, and seeking. It is made up of 4 levels. First one being prerequisites for person-centered practice, then the care environment, then the person-centered processes, and lastly, person-centered outcomes. The principles of person-centered care are treating people as individuals, respecting their rights as a person, building mutual trust and understanding, and developing therapeutic relationships. According to the Person-Centered Practice Framework by McCormack and McCants, the prerequisites of healthcare professionals include the following attributes: professional competence, developed interpersonal skills, commitment to the job, clarity of beliefs and values, and knowing self. So what do these attributes mean? What do they look like when caring for our patients? Let's explore them a little further. The Registered Nurse Standards for Practice requires nurses to maintain their capability for professional practice. Registered nurses are held accountable for providing safe care within their capabilities. An essential criterion for being professionally competent is the competency frameworks, which are produced by the bodies governing the profession. These competencies are becoming more focused around person-centeredness, and this person-centeredness is then becoming more and more evident through competencies and curriculums. You can achieve this through continuing professional development and further studies. If you are ever in a position where you do not know how to perform a duty, the safest option for you, your colleagues, and your patients is to just step aside and seek help. It is important for a nurse to have well-developed interpersonal skills to communicate safely and respectively to colleagues, patients, and their families. The ability of the practitioner to communicate at a variety of levels with others using effective verbal and non-verbal interactions that show personal concern for their situation and a commitment to finding mutual solutions. Having the ability to read verbal and non-verbal cues can be the difference between a good interaction or a misinterpreted conversation. It's not always what is spoken, sometimes it can simply be the lack of eye contact or sudden change in posture that indicates someone is losing interest or patience. It is very important to engage with your patients so your body language matches your words. As a registered nurse, you must be able to develop advanced communication skills that enable them to engage in courageous conversations in order to get to the heart of what is important to the person themselves, and communications must always be safe, effective, compassionate, and respectful. Registered nurses must use a range of communication skills and technologies to support person-centered care and enhance the quality and safety. Commitment can be reflected through the actions and culture of both teams and organisations. It is critical that a certain level of dedication is achieved by the team as a whole in order to attain the prerequisites of person-centered care. Without this, a single nurse's actions will have a far less significant impact upon the manner in which patients are treated and cared for. A nurse needs to maintain strong professional values. Commitment to the job is an essential aspect of the person-centeredness model, as being committed to the job at the most basic level reflects dedication and a sense that the nurse wants to provide care that is best for the patient. Commitment to the job on an individual level refers to a nurse who demonstrates their dedication through providing a high standard of care to their patient by going that extra mile. Everyone has different life experiences and different perspectives that shape their beliefs and values and ultimately their identity. Beliefs and values influence our behaviours and how we react to certain situations. They may not often be explicit, but rather assumptions that we make as a result of our beliefs and our values. In order for a nurse leader to be efficient and effective, they must be able to work through situations that may challenge their values and beliefs, and use this to create growth within their own personal development. It is important when starting the journey into becoming a registered nurse to take time to clarify your own beliefs and personal values, and then align these values with the values that are implemented by the profession of nursing. Philosopher John McMurray highlights his thoughts on knowing self in the McCormack's and McCann's book, insisting that healthcare practitioners involved in care delivery need to be aware of self and how their own values and beliefs can impact on decisions made about a person's care and their treatment. The Code of Ethics for Nurses in Australia supports this statement, requesting nurses to value respect and kindness for self. Respecting oneself allows nurses to develop their understanding of personal well-being and act in ways that strengthen their self-worth. In practice, this may be as simple as recognizing when you need a break. No one knows your body and mind like you do, so it is important to be aware of the signs. Knowing self requires you to be able to reflect in and during action as a registered nurse. We have to be able to be open to giving and receiving feedback and being able to work through that feedback through critical reflection on ourselves. Knowing self requires us to increase our personal self-awareness. This can be difficult as it pushes us to face the things we don't necessarily like about ourselves, and also can bring painful experiences from the past that colour how we act in the present. Self-awareness tends to come along with lifelong learning and personal growth that is all based around the core of self-reflection.
In the real world of practice, there are always going to be challenges when enacting these prerequisite components. In Australia, nurses' ambitions for person-centred care are often challenged by healthcare policies that drive patients throughout in a resource-constrained environment. The Australian College of Nursing believes that healthcare organisations need to design and implement policies which support person-centred care to achieve a better balance between economic and quality of care imperatives. It is really important nurses work within their limitations and knowledge. The role of a nurse is to support a patient, but you do not want to provide incorrect reassurance. There may be times you cannot get a hold of a pharmacist to prescribe medication at 2 a.m, or the doctor hasn't had a chance to check x-rays. Being able to communicate with someone is a valuable skill. Understanding the tone in someone's voice or acknowledging non-verbal communication can mean you are able to foresee a possible issue arising and have the chance to change the direction of communication. Communication is powerful in an interaction. Sometimes you may need to assess how the patient is perceiving what you are saying in order to establish a great communication path. One way to do this may be to have the patient explain what you've just asked or told them in their own words. As a registered nurse, you will face an array of challenges associated with your own values. Everyone thinks differently and therefore has different values. This means, more often than not, your values will clash with the patient's. Some registered nurses may come across conflict between their values and the organisation's values. For example, a lot of hospitals place high importance on quick interactions with patients in order to maximise profit and minimise costs. This can lead to patients having bad experiences in healthcare systems and may result in patients feeling anxious about returning to a hospital. As a nurse, we want patients to feel cared for and comfortable and ultimately have a good experience in the healthcare system. In some cases, your personal values might be challenged. For example, you may believe breastfeeding is the best option for all mothers and babies, but a patient may believe that it is bad. In this instance, we need to acknowledge that yours and the patient's values are not the same, but we can't let that conflict disable our ability to give the best person-centred care possible. It is common knowledge that nurses work long hours and sometimes due to staff shortage miss out on their breaks. Being tired can lead to getting a little cranky and making mistakes, things that certainly do not help you care for your patient. Alfred Health have recently released a free mindfulness app. They are hoping this app helps manage some of the pressures faced by healthcare workers. Features of the app are 30 different guided meditations and gentle yoga movements that last between 40 to 45 minutes. You can download your free copy on the iTunes today via the link below. Throughout the world, nurses make up the majority of the healthcare systems, and yet we are confronted with the lack of recognition actually given to nurses. In 2009, the then President Hiroko Minami and current CEO David Benton of the International Council of Nurses said, "Nursing initiatives have resulted in significant improvements in the health of patients, populations and health systems. However, the nursing contribution to healthcare innovation is seldom recognised, publicised or shared among nursing and the wider public. We do know there is a lot of support available to the nursing community, and you only have to speak to nurses in the field or listen to the passion and knowledge of university lecturers to know nurses are in fact an integral part in the day-to-day workings of a healthcare system." In 1952, an American nurse by the name of Hildegard Paplow took the initiative to write and publish her theory on interpersonal relations in nursing. Since then, it is recognised that many have used her theory as a starting point to expand on her theory. Some of these expansions are practiced today. Paplow's theory has been acknowledged as a useful foundation for nurses and is still available to all healthcare professionals. Hildegard's theory has been translated into several different languages and incorporated into virtually every nursing specialty. Hildegard's innovation was so well recognised she was inducted into the American Nurses Association Hall of Fame. Much like the person-centered framework, Hildegard recognised to have a therapeutic nurse-patient relationship. The nurse needs to understand their own values and beliefs, and know self by reflecting on past experiences and commit to the job by setting clear expectations. In return, the nurse must acknowledge the patient's values and beliefs, consider their past experiences, and also discuss what their expectations of their own care would be. As a group, we have practiced on both Hildegard and McCormack and McCain's theories and understand the value in reflecting on the meaning of each attribute to better understand a successful nurse-patient relationship. Another distinguished nurse innovator is Jean Watson. She has been referred to as a nursing rock star. Jean developed the theory of human caring. With an array of awards honouring the work she has done in the field, Jean has founded a non-profit organisation called Jean Watson Science Institute. The institute was created to advance the philosophies, theories and practices of human caring. This is known as a pledge tree and was started by changeday.com.au. There are many uses for this pledge tree. However, the PA hospital took it upon themselves to develop and implement this to improve person-centered care in the healthcare setting. An example of some types of pledges that were pinned to this specific tree were, "I will involve my patients in their care, improving patient care." If you want to check out some more of these pledges, just head over to the link below. As a group, we agree person-centered care is about focusing on the patient and not the disease. We also agree it is important for all healthcare workers to understand person-centered care to provide consistent and safe care to all patients. The Code of Professional Conduct for Nurses in Australia contains a number of conduct statements which set out the minimum standards that a professional person is expected to uphold both within and outside of professional domains in order to ensure the good standing of nursing profession. Lastly, let us leave you with this thought. You're caring for a patient with a brain injury. Also caring for this patient may be a doctor, a surgeon, a physio, a pharmacist, a dietitian, occupational therapist or a social worker. If every one of these people gets involved in the patient care and can appreciate the person-centered framework and work as an interdisciplinary team, then we will all be speaking the same language, and your patient is going to receive the dignified, empathetic care they deserve in their time of need.